REDCap data entry for clinical trials has to be fast, efficient, and clear. Research teams don't have time for slow workflows that fail to give them a complete view of participant data. Efficient data management is essential to the success of any clinical trial, and REDCap has become one of the most widely adopted tools for exactly that reason. Its data capture and management capabilities are well established, but how teams configure and use it makes all the difference. Quick data entry matters more than most teams initially appreciate. Clinical trials involve substantial data collection, from patient surveys through to trial outcomes. Faster entry reduces the time required to run those trials and improves accuracy by minimizing human error. When data is processed quickly, researchers can analyze it in real time and make informed decisions without delay. REDCap data entry for clinical trials sits at the center of that process. REDCap is a web-based application built specifically to support data capture for research studies. It provides an intuitive interface for data entry, exportation, and importing data from external sources. Robust validation, tracking, and audit trails ensure data integrity and compliance with regulatory standards throughout. REDCap's customizable forms give clinical trial teams real flexibility for speeding up data entry. A few features stand out. Drop-down menus and radio buttons eliminate the need for typing and enforce data consistency, reducing the likelihood of errors. These should be used wherever possible, particularly for fields with a limited set of responses. Auto-validation allows teams to set parameters for individual data fields, specifying that a field must contain a number within a certain range or a date in a particular format. Errors are caught and corrected in real time, reducing the need for time-consuming data cleaning later. Conditional logic lets teams hide or reveal fields based on previous responses, reducing clutter and keeping data entry focused on what's relevant. Piping carries responses forward from one field to another, removing repetitive typing entirely. Beyond REDCap's built-in features, form design itself plays a significant role in the speed and accuracy of REDCap data entry for clinical trials. Grouping related fields improves the flow of data entry. When logically connected fields sit near each other on a form, there's less jumping around and a lower chance of missing or miskeying data. Descriptive fields can provide instructions or additional context for those inputting data, though these should be used sparingly. Excessive text slows entry down and risks important information being overlooked. Pre-filling fields based on known information, such as the current date or a participant's name, saves time and improves accuracy from the start. Investing time in optimizing REDCap data entry for clinical trials pays off consistently. Faster entry, cleaner data, and less time spent on corrections downstream are the direct results of getting the setup right. REDCap's features are powerful, but they work best when teams configure them deliberately, test forms before a study begins, and build communication workflows around them. Pairing REDCap with Mosio's automated SMS tools keeps participants engaged and data flowing in on schedule, so coordinators spend less time chasing completions and more time on the work that moves studies forward. Over 150 million reminders, alerts, and surveys have been sent with Mosio. Get an instant quote today at Mosio.com.